Hi, welcome to Case of the Day, another week, and we're on our 76th case titled Bubble Lucencies. So, this is a 68-year-old had pelvic surgery 4 months ago, presented with fever for 5 days, had a CT chest, and for all practical purposes, we'd say ill-defined opacity, some air bronchograms, normal proximal bronchi, a little bit of pleural effusion, pneumonic consolidation, right lung base, and you'd leave it at that, right? So, very easy to call this pneumonic consolidation, but if you look at it, it's a little unusual. There are these so called spared areas, it's a little too heterogeneous. And it's a good idea to look at the soft tissue windows. And the soft tissue or the mediastinal windows show these bubble lucencies or bubbly lucencies or bubbly consolidation, whichever term that you'd like to use. Now, this is unusual, and the moment you see this, it should raise a red flag for any of these entities. So, bubble lucencies occur when there are differing areas of low density, and it could be mucin, as in an invasive mucinous adenocarcinoma, thrombosis, here would be hemorrhage in COVID 19, fat and lipoid, and again hemorrhage in a lung infarct. And so then we looked at the sagittal and coronal images, and you can see really sharply marginated wedge shaped lesion with heterogeneous density here, and a very sharp, in fact, like a straight edge sign on the coronal images. And if you look at the signs of a lung infarct, this fits in perfectly um, in, into a diagnosis of lung infarct. Looked at the mediastinal windows again, and you see these prominent arteries extending towards that opacity. The mean reconstruction, like a chest X-ray, shows a very prominent dilated right pulmonary artery. So we advised the CTPA, which was done 2 days ago, and I saw this morning. That it was all patient had come for an opinion, and all of these were anyway being managed by the local team. And here the clear filling defects and pulmonary thromboembolism, unilateral, only right lower lobe pulmonary artery with an infarct. So the message here is that in what looks like a pneumonic consolidation, when we see bubble lucencies or central lucencies or bubbly consolidation, this should raise a flag of something unusual. And in this case, all the other signs suggested infarct and thromboembolism. If you want to read more about this, then case 91 at ctchestreview.com has all of this. That's the REF Classroom, my WhatsApp channel. Thank you so much for viewing this, and I'll see you tomorrow.